with you, and today we're going to talk a little bit about marijuana. The first thing that I like to talk to people about when we talk about marijuana is it safe and is it addictive? There's a lot of people who try to make an argument that marijuana is both safe and non-addictive, and so therefore it should be readily available and we really shouldn't worry about that. Well, the first thing, whenever I look at any intervention in medicine or in life, I want to know, does this make people live longer or shorter? And the answer in the case of marijuana is very clear. People who regularly smoke marijuana die younger. In fact, they die on average about 20 years younger than people who don't. So, it is not benign. Now, it is different than cigarette smoking. Cigarette smoking takes on average about 25 to 27 years off someone's life expectancy, and cigarettes increase the risk of lung disease and cancer, whereas marijuana does not appear to increase the risk of lung disease or of cancers. However, it does increase the risk of heart attacks and strokes every bit as much as cigarettes do. And that makes sense because of basic, simple carbon monoxide poisoning. Carbon monoxide is bad for you. If we were to look at someone who has never smoked or those sorts of things, or doesn't smoke regularly, within the last couple of weeks, apologize, their carboxyhemoglobin level, the amount of carbon monoxide bound to their red blood cells, is about 0.6%. Fatal is about 12%. Most people who smoke regularly, whether that is marijuana or cigarettes, are going to have a carboxyhemoglobin level of about 6, about halfway to fatal. And certainly that puts a lot of drain on your ability to carry oxygen because carbon monoxide binds to your red blood cells permanently and makes them unable to carry oxygen until they are destroyed at the end of their life. And it also increases oxidative stress in the lungs and the blood vessels, increasing plaque formation, high blood pressure, heart attacks, and strokes. So it is not a benign intervention. The next question is it addictive? A lot of people will try to argue that marijuana is not addictive, and that's simply not true. 30% of people who use marijuana regularly will have physiologic withdrawal symptoms if they stop. They will feel more nervous, they will feel more nauseated, they will become unable to eat, they'll feel distracted or antsy. These are real physiologic withdrawal symptoms, and they do occur regularly in people who use. Now, not everyone gets addicted to marijuana, but also not everyone gets addicted to alcohol. When we look at physiologic withdrawal symptoms from someone who uses heavy alcohol, it's only about 15%, but no one argues that alcohol is not addictive. And so when we look at these things, it's important to recognize that it is not free of risk. Now, I'm not here to make policy or to make arguments about policy, but I want to make sure that if we do make arguments about policy or decisions that we make those on the basis of understanding things well, understanding that there is an addiction risk with this plant, and there is a risk of increased mortality. So what can we do if someone is on marijuana and wants to get off? Well, most often, people can just stop on their own. They don't usually need help, but many people do come to me because they're having trouble stopping. The most common addictive symptom that people have in terms of having trouble to get off of marijuana is anxiety. Marijuana is a medication, as it were, that does reduce anxiety. However, it reduces anxiety a lot like alcohol reduces anxiety. So you feel better while you're high, but then you feel worse afterwards. So oftentimes, my treatment as an addiction doctor to help people get off of marijuana is simply to treat their depression or anxiety with normal medications. If people aren't struggling as much with anxiety, then they don't feel as much need for the marijuana and they're able to stop. The other thing that we run into with marijuana, which is a very frequent complication, is marijuana-induced hyperemesis syndrome or cannabis-induced hyperemesis syndrome, where people either can't eat, become nauseated, or violently vomit if they don't have their marijuana. So it turns out marijuana is such an effective anti-nausea medication that it can actually become addictive in that way. And I've certainly had people I've had to hospitalize to try and get off of marijuana because without their marijuana, they puke their guts out, and we have to support them through that, give them IV fluids, antiemetics, anti-nausea medicines, in order to try and help them get through that process. For people who have more mild symptoms, we can do several things. One, we can reduce the dose slowly with the marijuana. That's a possibility. Anti-nausea medicines like ondansetron can be helpful. um, and working with them to understand that the reason they feel this way is because the marijuana is addictive, and so there's a good reason to get off. Another medication that's been shown to be helpful in helping people quit marijuana is N-acetylcysteine. It is available over the counter. It is used as a natural decongestant, but it also seems to decouple the marijuana from the pleasure response. People who use N-acetylcysteine in studies have been shown to report a 30% reduction in their cravings for marijuana, and probably in the range of a 30% reduction in the amount of marijuana that they smoke. It is inexpensive. 600 milligrams twice a day is often in the range of $10 to $15 per month, which is generally cost effective for the amount of marijuana that you can reduce, and it's well tolerated. Other options for treatment also exist, so if you have any questions or trying to get off of marijuana, I'd be happy to see you in clinic. Feel free to call the office. Thank you very much and have a good day.